level of language you can use, what knowledge you can assume, and what you have to explain. I think that's just the same for any conversation.
Yes, yeah, it is. Okay. Are there any specific services you'd like to see developed to support and care for people with lung cancer? This might be through charities or the hospital system, or it might be something you would have liked help with along the way.
Look, I know there's organisations out there that, of people who have cancer, the group meeting up with other people who have cancer and what have you.
Yeah.
And I think I might have benefited from that, although in the early stages I was too wretched to be interested.
Yeah.
And after, once the treatment took effect, I didn't feel I needed it.
Yeah.
Except when, amongst our friends, there's someone who's got cancer. We immediately, got into all sorts of details that the rest of the group don't want to know about or know about. I don't quite know how to engineer that, but obviously talking to other people who've got cancer is helpful.
Yeah. Okay.
But I don't know how you bring that about.
That's all right. Okay. Well, we've only got a couple of questions left. I'm sure you're very pleased to hear that.
You've gone faint again.
Oh, sorry. We've only got a few more questions left.
Yeah,
so
I'm struggling to hear you. You seem to have moved away from the phone.
What advice or tips would you give to other patients and families affected by lung cancer? This might be general advice or perhaps something you've tried that's worked really well for you.
Firstly, get at least one other opinion. Most important. Secondly, let them know it may be fatal, but there may be a cure.
Yeah.
You just don't know until you probe further and look things up.
That's a very good point.
Yeah, I think you've got to be realistic, but really, a lot of, as my oncologist said yesterday, most people with your cancer would be dead by now. So yes, the 2-year survival rate and the 5-year survival rate are a bit scary, but. Yeah, look, there's no way of avoiding the anxiety until you know what's going to happen.
Yeah.
But I think people should know right off that it could be fatal. But it could be that there's a cure.
Yeah.
You've got to explore it, that it isn't a generic thing. Every cancer is different, I think.
No, that's a very good point.
And that seems to be more and more the case. So just having cancer is the start of the diagnosis, it's not the final diagnosis.
Yeah, no, that's a very good point. Well, we're lucky in Australia to have a good health system. Is there anything you've been particularly grateful for in relation to the services or treatments you've been able to access?
Yes. Okay, I've had to fork out for the drug quite a lot of money, but PET scans, oncologist visits, the day clinics fees, all of those have been covered either by Medicare or by my private health insurance. The GP visits and a couple of scans I've had out of pocket money. I mean, Medicare. the Medicare rebate is about half of what most doctors charge for, and most GPs charge for normal visit. And, you know, I've had to see the eye specialist, ophthalmologist, and there's always a significant out-of-pocket expenses there. So I think, while I'm grateful to Medicare for covering, for example, the PET scans, which would cost about $900 if I had to pay for them. That's what the hospital charges Medicare, I think. I think there are deficiencies there.
Yeah.
That you know, freezing the Medicare rebates for GPs is scandalous, I think. I hope that policy changes soon. So, otherwise, I'm quite familiar with the healthcare system in another country, in Greece, having lived there for a number of years, and basically, drugs are a lot cheaper there, and anybody can get, like in Australia, anybody can get hospital care, and they have a parallel private system as well.
Okay.
I've been able to. I mean, when the first diagnosis came in, cancer diagnosis came in, it only took a few days before, a couple of days before appointments were lined up with the appropriate specialists. So that was good. They didn't muck around. It was quick start.
Yeah. Oh, that's good. Okay. If you were standing in front of the health minister, what would your message be to him about the types of treatment and care people with lung cancer have access to?
Inadequate. Inadequate and expensive. But the PBAC is independent of government. You're right to Mr. Hunt, and he says we can't dictate to the PBAC.
Yeah.
Which is fair enough. But the government does set sort of a general framework, and when you find PBAC is delaying listing all sorts of things because of the price, that seems to me to be that those cost restrictions are certainly imposed within the government framework. PBAC shouldn't be haggling about price. It's a question of the effectiveness of drugs, not their cost, that they should be concerned about. So Mr. Hunt can wash his hands by getting the PBAC to do his dirty work for him, which is not the way it should be.
No.
And as a consequence of that, a lot of people are missing out. And every time they put some new drug on the list, a big press release, ministers, makes a statement. This is going to save the lives of, or make life a lot easier, or make treatment affordable for, these rare cancers that they're now coming out with. That particular lobby has succeeded in pushing, successfully, getting treatments available for so-called rare cancers. So while the minister is happy to make an announcement saying how much he's saving people, he's quietly allowing, or the government policy framework quietly allows a lot of people to miss out because feedback is haggling over the price. So inadequate and too expensive.
Yeah. Okay. Well, that brings us to the end of the questions now, so I can leave you to get on with the rest of your day. Have you got anything planned for this afternoon?